Even though it's 2025, I want to go back and revisit a subject that I know a lot about and that was very passionate about in 2020, 2021, 2022. And that is the concept of hydroxychloroquine and ivermectin being made over the counter. First, let me just talk a little bit about those meds specifically. Hydroxychloroquine has been FDA approved for about 70 years. Ivermectin won the Nobel Prize in medicine, I think in the year 2015. These are drugs with a tremendous safety profile. There is a government database called F, as in Frank, FAERS, for the FDA Adverse Events Reporting System that keeps track of adverse events of medications. And in the FAERS database, hydroxychloroquine is simply one of the safest drugs on the planet. We know it's safe. There is no dispute that it's safe. It's just that during COVID, there were a lot of liars who lied to you and told you that it wasn't safe, but it's well known to be very safe. Another interesting fact about hydroxychloroquine is that it's over the counter in most of the world. It's not over the counter in America because there's been no market demand to make it over the counter. The countries where it's over the counter is because there are customers who want to buy it. Those countries are typically in Africa and sometimes in South America. Why is that? Hydroxychloroquine has a lot of uses. In America and Western nations, its major use is to treat rheumatoid arthritis and lupus. These diseases, the patient really always has to follow up with a physician because there's a lot of issues with those diseases. And so in those cases, when a person needs hydroxychloroquine, their doctor will happily prescribe it for them. So there really wasn't any market demand to make hydroxychloroquine over the counter in our nation. But in other nations where malaria is a problem, hydroxychloroquine is found over the counter. It's not even considered, it's barely considered a drug. It's considered more of a vitamin. It's frequently found in the vitamin section in many other nations. So I just want to start with that it is over the counter most of the world. And that's because there's people most of the world who will buy the medicine. Whereas in America, we don't really have a need for it because our predominant need is to treat a disease that already needs a physician's intervention, specifically RA and lupus. So, and ivermectin, it's kind of a similar story. Ivermectin is used for parasites. It's a very, very safe medicine, a wonderful medicine. Over the last couple of years, there's been a lot more attention to its potential uses in cancer treatment. A comment that may get me banned off of YouTube, if this is on YouTube, true nonetheless. So these are very amazing medicines with wide potential. However, they are generic medicines that are not profitable to big pharma. So therein lies the rub. When you have a drug that's not profitable to big pharma, where it can't sell it, it's not a brand name, for example, it doesn't command a high price, there really is not much incentive, if any, to bring it to over the counter status. There really isn't an owner, a drug manufacturer who really wants to do that. They don't really see a clear way to making money by just putting it on the drug shelves. So they don't really want to bear the expense, understandably, of going through the process of asking the FDA to convert it to over-the-counter. There are many examples of our FDA converting prescription drugs to over-the-counter drugs. Naproxen, a widely used anti-inflammatory sold as Aleve or Naproxen, at the drugstore, was for many, many years, even during my career, was only available by prescription. But drug manufacturers realized it had enormous profit potential as an over-the-counter medicine, and they petitioned the FDA correctly to make it over the counter, and it did. We don't have that incentive going on in America to make these drugs over the counter. So what can we do about that? About a prescription medication that has tremendous usefulness, should be over the counter based on its safety profile, but does not have a pharmaceutical manufacturer who wants to bring it over the counter. Well, it turns out there is a mechanism where we, the people, can request that the government make this drug over the counter. It's called a citizen's petition to the FDA. Citizens can file a petition requesting a particular drug be made over the counter. This is something that has been used in the past. Plan B, which is an early abortifacient medication, was brought to over-the-counter status by citizen activist group who petitioned the government to make Plan B over the counter so that people who wanted to purchase it could purchase it without a doctor's visit, doctor's prescription. That is one way the citizen's petition to the FDA can be used. And we also can use that process. Filing a citizen petition to the FDA to make hydroxychloroquine over the counter, to make ivermectin over the counter, is a fantastic idea. And it just so happens that yours truly, Dr. Simone Gold, and America's Frontline Doctors filed this application in October of 2020. And it happens that the FDA received it, I have proof of that, and did not rule on it. Till this day, they haven't ruled on it. Periodically, every 6 to 12 months, I got a response back from the FDA saying they had not yet ruled on it. But that application is already sitting in the FDA. I filed it October 13th, I think, 2020. And what I'm going to look into is reactivating that citizen petition. And I ask all of you listening, hearing me, to join me in this. If we had hydroxychloroquine and ivermectin over the counter, you, potential pain patients, would be tremendously empowered. You wouldn't have to see a doctor if you wanted to get your hands on these medicines. You could do the research yourself if this makes sense for you. You wouldn't have to worry about supply chain issues where a pharmacist or pharmacy doesn't have it. This is a win-win for all concerned. I know that this is something I will work on, and I ask your assistance in this measure. I know that there's some states that have looked into this. Tennessee, for example, made ivermectin over the counter, I think behind the counter, a couple of years ago. And we're just going to be working on this hard at America's Frontline Doctors. I hope you will join me. Thank you for listening. This is Dr. Simone Gold.